Before we get started, I would like to read the disclaimer on your screen. The PharmAssist virtual learning experience brought to you by Mandel's Clinical Pharmacy is intended only as an educational program for patients. Any clinic-specific information shared by the nurses is the opinion of the nurse and is not intended to replace the recommendations or requests of your healthcare professionals. All medications will be dispensed by Mandel's Clinical Pharmacy according to the prescription as written by the provider. Now that we've gotten that out the way, I would like to welcome you to the program. My name is Toni Newman. I'll be your host tonight. I've been a fertility nurse for about 3 years, and I'm excited to be part of this education program with Mandel's. Thank you for tuning in to PharmAssist Virtual Learning Experience, an educational program created by Mandel's Clinical Pharmacy to bring you together with outstanding healthcare professionals right from the comfort of your own home. PharmAssist takes place every Monday at 7 p.m. Eastern. Tonight, we'll be providing a live medication instructional program on 3 common fertility products. Tonight, we're going to discuss the Gonal F 75 unit vial, Avidrel, and progesterone in oil, including an interactive Q&A throughout the program. Please join us via Zoom or Facebook Live, and we invite you to be part of this discussion by sharing your questions in either format. We encourage this to be an interactive discussion, so please ask away. We are joined by various amazing healthcare professionals each week from across the nation that will provide you with a real-world experience, just as if you were sitting across the table from them at the clinic. Tonight, we are joined by Karen Hammond. Thank you again for your time and interest this evening, and I'm going to go ahead and turn it over to Karen.
Awesome. Thank you so much, Toni, and thank you for agreeing to host this evening's program. I am Karen Hammond. I am a women's health nurse practitioner with a doctoral degree, and I am a co-owner of Innovative Fertility Specialists in Birmingham, Alabama, where we offer affordable fertility treatments, including in vitro fertilization with InvoCell. I'd like to start out by thanking not just Toni, but also the folks at Mandel's Clinical Pharmacy. PharmAssist is a program that was certainly their brainchild, just to give you a little bit more comfort and peace of mind when it comes time to sitting down to actually do your medications. When you get your box of medications from the pharmacy initially, everything that you need should be in there. You'll have all the needles and syringes and instructions and patient information. Sometimes you open it up and it can be a little bit overwhelming even. But please know that your healthcare providers, your pharmacists at Mandel's are always here to help you, and we want this to be very easy for you. So we want to take out all of the steps along the way that might make you a little bit anxious, and hopefully these videos will give you just a little bit extra help to put your mind at ease. These videos, the one tonight, as well as all of the other ones from various nurses across the country, are archived at mymandelsPharmacy.com, as well as on the Mandel's Pharmacy website, the Facebook page. So when it comes the day for you to actually do your injection, you may want to take a look at my videos or some of the other providers' videos. And you can even do it like a workout video, so you can mix along with us as you watch the video. We just want to make this easy for you. So I've been doing this for a long time. I am now in my 37th year in taking care of women and couples and folks that are struggling with fertility issues. And I have, having done this so long, a lot has changed. We have new medications, and believe it or not, they are so much easier to do than they were when I first started in this field. It used to be there was one fertility injectable drug. It was given in the muscle of your hip, and you had to mix a little bottle of liquid and a little bottle of powder, but it was real bottles. It was little, they call them ampules. It was glass bottles where you had to snap the top off of it. And this was even before there was a little place that you snap the top. It came with a tiny little prison file, I called it, where you'd have to file a little bit on the glass ampule to score it and then snap it to open it. So we've come a long way now with pens, with pre-mixed medicines, having the medicines in vials, and having the internet, actually, so you can have programs just like PharmAssist to help you walk through the medications. So as Tony said, I'm going to talk to you about 3 different medicines tonight. Feel free to ask questions anywhere along the way. You can type them in either on Zoom or on Facebook, and Tony will be compiling these questions to make sure they all get answered. If I start talking about another product and you still have a question back on the first one, that's okay. Ask whatever you've got whenever you like. We want to make sure that you feel comfortable. This program is designed for you, and we want it to be as beneficial to you as we possibly can. So with that being said, while Tony cues up the video, the first product I'm going to talk to you about is Gonal-f 75 international units. Gonal-f is a fertility injection. It's given just in the fatty tissue of most commonly your abdomen or the back of your arm or the outer part of your thigh. And it is follicle stimulating hormone. One of the few hormones in our bodies that does what it says it's going to do. It stimulates follicles to grow. So this medicine is oftentimes given if you don't ovulate normally. Perhaps you're undergoing an insemination or trying to super ovulate, so you have more than just a single egg to mature, or maybe you're doing in vitro fertilization and you need more and bigger eggs so that you'll have lots of eggs for retrieval and hopefully some embryos from which to choose. So Tony, let's go ahead and have you start that video on Gonal-f 75, and then we'll answer some questions at the end. Hi, I'd like to talk with you a little bit about how to give the Gonal-f vial. It will come in a package that has a vial, 2 needles, and a syringe that has the saline to dissolve the powder that's in the vial. You start by just simply opening the package and removing the contents. Next, there's a little cap that covers the tip of the syringe. Just unscrew that to remove. Then you can put the needle directly onto the syringe. Your provider will tell you whether to use an intramuscular or subcutaneous needle. In general, this is given subcutaneously. Next, you'll take the top off of the needle and grab the vial that has the powder, the medication in there. Gently lift off the top of that vial. Put the needle directly into the rubber stopper on the vial and inject all of that liquid into the vial. Each vial has 75 units of Gonal-f in it. If you're prescribed more than that, you may need to use more than 1 vial. You'll still just need to use one syringe with the liquid. Next, turn the vial upside down and withdraw all the liquid by pulling back on the plunger. After you removed all the liquid, remove the needle from the rubber stopper of the vial, and you're ready to give the injection. Start by just wiping off the area that you've selected to do the injection. One time, put the needle straight in. After you've bunched up the skin, slowly push in the medicine. Release the skin and pull the needle straight out. If there's a little drop of fluid or some blood on the outside, just simply wipe it with some alcohol and apply a bandage if necessary. Finally, take the syringe with the needle on it and drop it into a sharp container just to prevent any injury from it later on. And now you've given your first Gonal-f vial. Wow, that was pretty easy, huh? It's nice that you've already got the liquid all right there. The 75 units is the amount of powder that comes in each of the vials. And if you've been prescribed 2, for example, 150 units a day, all you need to do is to draw up that entire mixture and then squirt the mixture into the next powder. And when you draw that up, it's using just still one syringe of liquid, and you have 2 powders. And you can go up and up depending on what your actual dosage is. This medication can come in really handy if you don't want to, for example, buy another 450 unit pen or multi-dose vial. If you just need a little bit more to tie you over, this can be a perfect regimen for you, just to get these little 75 unit vials to give the last little bit of medication that you may need. It's really, really easy. You just pinch an inch pretty much anywhere. You can pinch an inch is perfect. You may have noticed that I said on the little drawing that you should go beneath your belly button and out to the side a little bit, like where I have these little blue dots right there. Um, the books, the nurse books say you can go anywhere around the belly button, but I tell you, it's very few women that don't have a little bit of an inch they can pinch beneath their belly button. So that's why I generally say to do it in that area. Just pinch it up a little bit, wipe it once with alcohol. We know you're clean. You take a shower. There's no point in scrubbing it. In fact, I don't really think there's much point in even using the alcohol. I think it just moves the germs around. We're taught to do that, and they do it on TV, so we should need to do it too. So just wipe it off if you like, put the needle straight in all the way and squirt it in the medicine. This medication is actually quite comfortable when you give it. Most people are surprised at how easy it is. When you put the needle in, most people do not even feel it. You may feel a little bit of a sensation when you push the medicine in, but it's not painful. And if you have a little bit of blood leak out right after you're done, just kind of swab that off. Most people don't need a Band-Aid. If it's me, I'm going to probably bruise from the adhesive on the bandage more than I would from taking an injection. So don't worry about that at all. You can just apply some gentle pressure too, and that would stop any kind of bleeding that you may have. Most people don't have any bleeding. Just put the needle in, push in the medicine, and you're good to go. Think about people that take insulin. Think about diabetics that are on insulin. Now it's even been studied that you can do that even through your clothes. If you need to hurry and take insulin, you can do it through your pants legs or the body of your pants. You don't even have to do that. So don't worry about whether or not you're going to have germs or cooties or anything, just to have to scrub it with the alcohol. Easy peasy to do. I'm going to turn it back to Tony now, see what kind of questions y'all have, and I'll be happy to address those.
Hey, Karen, thanks. One thing I thought was interesting too, where you do your injections, one thing I teach our patients in the clinic, where their belly button is, if they were to draw like a smiley face on the stomach, your eyes would be in line with the belly button. And then anywhere you'd have the mouth. So sometimes I'll draw that out on their paper, and that kind of helps them to see, on the mouth, either side, and the sub-Q tissue right there. That always kind of helps.
That's a great idea.
Yeah.
Great idea.
People like those visuals, so.
Absolutely. And a smiley face, what better thing can you have than that?
Right. So one of the first questions is, how exactly does Gonal F work to support my fertility cycle?
So great question. And I love it when people ask these kind of things. Why are you taking this medicine, and what is it going to do? How is it going to be of help to you? As I said before, Gonal F and Follistim are a means of injecting a medicine called follicle stimulating hormone that stimulate your follicles to grow. In a spontaneous cycle, our bodies say, oh, the estrogen's low, so your brain will make more and more and more FSH until the egg gets big enough. That's what happens in a natural cycle. And there are all these little positive and negative feedback loops that keeps you from making too much or too little to have normal ovulation. When we use this medication, especially with Gonal F or with Follistim, it is to stimulate multiple eggs to grow. So it's giving more than you would make on your own to grow eggs in response to low levels of estrogen. So it's going to push your ovaries a little bit harder, and hopefully you'll have development of more than a single egg. And that's why it started fairly early in your cycle, So it can kind of jump on top of your spontaneous cycle and kind of take over before you would start to develop and mature eggs on your own. Great question. I always love it when people ask why you're doing what you're doing instead of just take it and trust us.
Definitely helps to know why you're doing stuff. Okay, it looks like the next question, what is the main reason that I would use the 75 unit vial versus the pen?
Great question there too. There are different formulations of these medicines. There is with Gonal-F, there is a pen where you just dial your dose and give it. There is a multi-dose vial where the little bottle doesn't have just 75 units. It may have 450 or more medication in it. There are a couple of strengths of that. Or you can just have the 75 unit vials. I think it's important to consider what is going to be the most cost effective. My entire practice and mentality is based on kind of getting the most bang for your buck without breaking the bank. These medicines are expensive. They're about $1 a unit if you're having to pay for them out of pocket. So if you just need a little bit more to get by with, or if maybe you're taking a very low dose, if you're just taking 75 units a day, this might be the right thing for you. So you don't have to pay for medicine that you're not necessarily going to need. With the pen and with a multi-dose vial, once you open it or once you mix it, it needs to be used within 30 days or it's no longer going to have the same potency. With this, you're not going to mix up more than you're going to need. So it may be a little bit more cost effective in the long run. Your doctor or your nurse, probably your nurse, is going to help you figure out what is going to be the most cost effective thing for you and which formulation or which product your insurance may help you cover. The other medication, Gonal-F and Follistim, they're essentially the same thing. They're both FSH. And in my practice, I use them interchangeably. It's just going to factor into what is least expensive for the patient and what is most likely to be covered by the insurance company. Great question.
Yeah. Next question we have, how long am I typically going to be on Gonal-F?
Great question. And, you know, one of the beauties of this medication and of fertility treatment in general is everything is custom made for each patient. Every cycle's a little bit different. I can tell you if you are taking just Gonal-F, the average length of time people take that is between about 5 and 10 days. But those are averages. You may take less, you may take more. It's also going to depend on why you're taking this medicine. Are you taking it because you just don't ovulate normally and you need to ovulate an egg or two for an insemination? Or if we want to be more aggressive with your ovaries, and hopefully you're going to have 8 or 10 or 15 eggs to get to be mature, you may take a higher dose or take it longer. That's something that you should definitely talk with your healthcare provider about. Your nurse is going to be pretty well versed in letting you know, on average, based on why you're taking it and your health history, your nurse is going to be really good at being able to guess at exactly how much medication to prescribe, and she can help you out with knowing the number of vials or the best formulation for you.
Thanks. Well, I don't see any more questions right now. Is there anything else that you might want to add before we move on to the next one?
Sure. Yeah, I just want you to be very comfortable with this. This is these subcutaneous injections, the one that just go in the fatty tissue, they are the easiest of all the injections. The others aren't harder, but some of them, if you're using a longer needle, that can be a little bit more intimidating. Actually, they all feel about the same. Tony can tell you, I know I have given myself a number of these medications when they first came on the market. I wanted to see how the pen worked. I wanted to see what it felt like when you take these medicines. And I just did a little bit of it just to know what it was like. And it's a very easy injection and it's not uncomfortable at all. So don't panic about it. The first injection is always the hardest because you don't really know what to expect. Just like the first time you do most anything, it's always the scariest because you don't really know what to expect. Think about the first time you jumped off the deep end of the swimming pool. It's kind of scary. But after you've done it once, you'll be able to and it'll be really easy.
Yeah, we get a lot of very scared looks in injection teaching calendar class. So, but yeah, like you said, once you get that first one down, I always tell people, like, this whole cycle flies by. You're 2 weeks and you're done egg retrieval, and you're like, can't believe it after all the planning.
That's right. I tell people at their baseline ultrasound, it goes so fast from here, you're not going to believe it.
And they never believe you. But the next thing you know is their pregnancy test, and they're like, wow, it's crazy. Really exciting.
Perfect.
Yeah, so I think that's all the questions we have. I'm going to go ahead and just get ready for the next video.
Okay, perfect. So the next product that I'm going to talk to you about is Ovidrel. So after you've taken medicines to stimulate your ovaries and your eggs are likely to be mature, we can tell that by blood test, possibly, and certainly by doing an ultrasound to take a look to see how big the follicles are. That's the sac that actually contains the eggs. Then we'll tell you when to take an injection of HCG. Ovidrel is HCG, but it's made in the lab. It's not human derived. It comes already mixed and ready to give. All you have to do is take off the top and give it. The tricky thing about Ovidrel or any type of HCG is it's very important you take it at the time that it's been prescribed. We'll talk about that a little bit after the video. So Tony, if you want to go ahead and set it up, we'll talk about the trigger shot of Ovidrel. It's 250 micrograms. So you can go ahead and start that video. I'd like to talk to you about administering Ovidrel. If your prescriber has recommended you take Ovidrel, chances are you were told to take it at a very specific time. Good news, it's very easy to give this injection. The Ovidrel comes in a little package like this, and you simply open it up and remove the inside part like that. Fortunately, with this medicine, it's in a pre-filled syringe, so the medication is already drawn up, mixed, and ready to administer. You just pull the plastic tab off and then choose the site that you want to give the injection. Since this is a subcutaneous injection, that means it goes into the fat. Most people recommend that you take it beneath the belly button, out to the side an inch or two and down an inch or two, or either in the outer thigh. Once you select the site to give the injection, you can use an alcohol prep just to gently wipe the area. So you bunch up the tissue, wipe the area once with an alcohol prep, remove the top from the syringe, and then put the needle straight in, all the way, depress the plunger, release the tissue, release the plunger, pull the needle straight out. Afterwards, you should put the needle and syringe in its entirety directly into a sharps container to avoid getting stuck with it. Congratulations, you've now given your first injection of your Ovidrel. Gosh, that one really was easy. It's already mixed. You just take off the top and wipe the area and administer the injection. Again, this just needs to go into fat. I liked what Tony said about making like a little smiley face below your smile below your belly button to know exactly where to give it. Some people will give it in their outer thigh. My favorite place is still to do it in the belly. It's the easiest place, I think, to give it. I know when I was growing up, my mom always told me not to go pet somebody else's dog or a stray dog, and I'm such an animal advocate and lover that I've never met an animal I didn't love, including my pet possum when I was a child, but that's a different story. But my mother would say, oh, don't touch those animals. They'll bite you and you'll have to get rabies shots in your belly for a month. And so that was just the scariest thing to me. And maybe other people's mamas did that too. When you worry about taking a shot in your belly, I can tell you that is the most comfortable place to take it. Um, Two, it's easy to see, it's easy to do. And now that we're getting into summertime, you can do it low enough that you won't show your belly in a swimsuit. Where if you do have a little bit of a bruise on your leg, people may see it, and you don't want, it's nobody's business. You don't want to make people wonder how you got bruised or ask about it and put you in an awkward situation. So if you do it in the outside part of your leg, it's just where if you put your hand down to your side, it's going to be right about where your palm rests. Other people will do it in the back of their arm. So if you rest your arm back on a table, you can just do it in this fatty part of your arm in the back. That works fine too. But I tell you, my experience over the years has been so much more favorable to do it in your belly. People um, just say that that's the easiest place to give and receive an injection. This is an injection just like the Gonal-F that you can give to yourself. The needle, you saw how tiny it is. It's right at a half an inch long. So it's just a tiny little thing. You can give it to yourself. Some people want their partner to participate in it and to kind of know what you're going through with every single injection. So it may be something that you want to do as a couple. I have other patients who want their partner nowhere near them and will have another friend or family member. I've had folks ask their school nurse to do it. Sometimes people will come by my office for us to do it. But for the HCG, it's important you take it at a particular time. HCG works by mimicking the LH surge. So it makes your body think it's making the hormone that's going to cause the release of the eggs. And once you take this, you're going to ovulate within about 40 hours. If you're having an insemination or an egg retrieval, most of the time your provider is going to tell you to take this injection at a very specific time. So people say 35, 36, 37 hours uh, after the HCG, they're going to want you to do the procedure, egg retrieval or insemination, sometimes having intercourse. Um, I like to I like to think when I talk to people about doing it, this is something that you need to either plan to do yourself or have your partner do. Set several alarms. Ask Siri to give you a call. Set your alarm clock. Set your television to come on, your radio to come on, whatever you need to do. There are lots of different ways to give yourself reminders, but do a reminder and a backup. Because most of us in fertility programs like to do procedures, including egg retrievals, during normal working hours. Your HCG may be in the middle of the night. So if your retrieval is at 2 in the afternoon, you may be taking the HCG 35 or 36 hours before. And so that's going to be at, around 3 in the morning. So you want to make sure that you have all of the backup set to make sure you take it at just the right time. This is one of those medicines that it's very specific to do that. It's probably the only one that has to be at a very specific time. If for some reason you get confused, you forget, all of your alarm systems fail, just this is one of those okay to call in the middle of the night and say, I've had a problem with my HCG, because your provider may be able to tweak the time of your procedure. It may be okay, but that's something you should talk with them about as soon as you can. So I'm going to stop rambling a little bit right here, and I'm going to see what questions we have gotten in to Tony.
Yeah, that was a lot of really good information. I hope some of my patients are tuned in, because we do get a lot of questions with trigger shots, and sometimes, we use a portal at our clinic. So sometimes they'll send a portal message if something happens with their medication in the middle of the night. And I do think it's important for all patients to know there's always the on-call line for them to call the office, especially for something like that. And you touched on this a little bit, but one of the questions was why is the timing so exact, and how much wiggle room do I really have when I'm taking the shot?
Great question. I tell patients when it's time to take it exactly at that time. The good thing with Avidril is it's already mixed. You can have it right beside your bed. You can wake up when Siri tells you to, give yourself the injection, and go right back to sleep. With some of the other medicines, some of the other types of HCG, you actually have to mix it. So it's a little bit more of a science project, kind of like the way it was with the Gonal 75 units. So with this one, it's really easy. Now, honestly, how much wiggle room do you have? You probably have an hour or two. I would not say more than that. I would say to try to take it as close to that time as humanly possible. And if you're off, I would say even by an hour, I'd rather you call me. So call your provider. Tony's exactly right. Don't leave a message in the portal, because even though most fertility nurses have a little OCD, they're probably not OCD enough to check the portal all through the night. So that is, I would love it if somebody takes their HCG at the wrong time and calls me up, no matter what time of the day or night it is. I will tell you, I've had this happen before. I've had somebody forget about it. I have had somebody who got her HCG from a friend, and when it was time to take it, the only thing that was in there was a partially used vial of liquid, and it wasn't even a vial of powder. And so she didn't have it. I have had people think, oh gosh, Karen told me to take my HCG at this time, and it's 35 hours before. Surely she meant the day before. So they wait a whole day to take it. And I've had people that just simply don't set their alarm clock or don't wake up and sleep right through it and don't take it at the right time. So always, always, always err on the side of calling rather than not calling. So we can try to make any adjustments that we need to. Sometimes when I've had this happen, we have just had people take another injection of something like Gonal-f or Menopur, or we've had people go ahead and take the HCG when they think of it, and we adjust the schedule that way. On rare occasions, like if your progesterone level goes up, we've had to cancel cycles. So I don't want to scare you into thinking, oh my gosh, I have to do this right. But I want you to realize, oh my gosh, I need to do this right. So you will have an alarm and a backup and whatever else you need. For most patients, don't fret about this. You're going to be excited. It's the injection you've been looking forward to, and you're probably going to be too excited to go to sleep anyway, even if it is in the middle of the night or in the wee hours of the morning.
Absolutely. How do you store this medication before you get the shot?
Great question. This medication, when you get your package of medicines from Mandel's, it's going to say to refrigerate it, and you should stick it in the refrigerator when you get it. But as long as you're going to be using it within about 30 days, it doesn't have to stay in there. I tell people if they're taking it during the night to go ahead and take it out of the fridge before they go to bed. That way it can come up to room temperature a little bit. If you're taking it at a more normal waking time of the day, just take it out a half an hour or so. Or you can take the syringe and you can rub it in your hands a little bit like this for a couple of minutes, and that'll warm it up a little bit. Sometimes it can sting a little bit if you inject cold medicine into your warm body. So I like for people to have it come to temperature just a little bit. It's not going to be anything bad if you give it and it's cold. You may just feel it a little bit more. Again, this injection is very simple and it doesn't hurt. It's not uncomfortable at all when you give this. If it's cold, you may have a little bit of a sensation, but it's not a painful sensation.
So another question coming through is, which you kind of touched on this, but it's always better to hear things again. What's the biggest potential risk if I were to miss this shot?
Gosh, the worst thing that could happen would be that your cycle is canceled. Actually, the worst thing that could happen is that you didn't fess up and say something, that you didn't take it right. Because if you don't take this and it's time and you go for your egg retrieval and you forgot it altogether, or if you didn't take it but 10 or 12 hours or 20 hours before you show up for your egg retrieval, chances are we're not going to get any eggs. The HCG not only tells your body it's time to ovulate, but it also does the final maturation of the eggs. So your eggs will not be as mature, and they might be too sticky, and they'll stick to the side of the follicle walls when they're really immature. So if that's the case, then we're not going to be able to get any eggs. And you'll have gone through all of this, and the cost and the egg retrieval may be for nothing. So that's, if you don't tell somebody, that's the worst thing that can happen. The next worst thing that can happen is that your cycle is canceled. I can't remember ever canceling somebody's cycle because they did it wrong. Now, I'm a little bit of a sucker, and I have done egg retrievals at somebody take it in the morning instead of at night. So they're off by 12 hours. So instead of it being 36 hours, it's 48 hours. There's nothing that we can do about that if we don't know in advance. But I have had a couple of patients call and say, gosh, I took this 12 hours too soon. I took it in the morning instead of at night like I was supposed to. And so I have been known to do egg retrievals at 9 or 10 o'clock at night. Not all programs have that capability to bring in the team to do that. And not all programs are going to be willing to do that. So the worst that can happen is that you won't get any eggs. The next worst that can happen is that your cycle will be canceled. The other thing is you'll be a little bit embarrassed, and we'll just make some adjustments to it. No matter what, we've probably heard it before. So don't ever feel self-conscious or concerned, or definitely not embarrassed if you call to ask a question or you didn't do something perfectly, because I can pretty much promise you, you are not the first person who's done that. And that's why I'm being really emphatic now, and as well as Tony, to say, try to do everything by the book. And the timing for the trigger shot is the most important.
Absolutely. Absolutely. That's a lot of good information on the trigger shot. It's one of the most important medicines for sure that we give, especially being with the timing. So I really don't think there's much more on that. I think you gave a really good overview, and I hope we answered a lot of good questions on that one. So if anybody has anything else they want to add, feel free to type it in the chat box. We can go back to Gonal. If you have a Gonal question, don't feel like, we've moved on, that we need to just, we can't answer that question, or any fertility question that you have for that matter. Do you have anything else to add, Karen, or you want to queue up for this?
Yeah, I just want to say, don't be intimidated. I know I've been pretty emphatic about take this exactly at this time. Don't be intimidated by this injection. It doesn't hurt. It's already pre-mixed. It's ready to go. You just have to remember exactly when to do it. And it's quite easy. There are other trigger shots that can be prescribed for you. Your healthcare providers, your nurse will be happy to talk to you about which one is right for you. You can certainly talk to them about what your options are, but they are always going to be looking out for you and doing what they feel is best for you and your particular circumstances. So if there are any other questions that come through, we'll catch them in a few minutes. But I think now we'll go to the third product that I want to talk to you about. And this medicine is probably the most intimidating for patients when I talk to them about taking all the medicines that they'll need for an IVF cycle. The number one thing people are worried about is progesterone and oil. This medication helps to support the lining of your uterus. So let's go back to a little bit of physiology before we show the video and talk about why you would be prescribed progesterone. Sometimes people are prescribed progesterone when they are having a spontaneous cycle, or maybe taking some medications. After they ovulate, they have a progesterone level done and it's low. And so progesterone is added. Maybe progesterone and oil. There are other oral and vaginal preparations that are available that may be prescribed for you. However, when IVF is done, I don't know anybody that doesn't prescribe progesterone of some kind. It's important with IVF because when we do your egg retrieval, we're not just getting that egg out of each follicle. We're actually getting the egg and all the surrounding fluid. So we aspirate all the fluid and the egg comes, it kind of flushes out with it. It comes out with the rest of the fluid. We look at the fluid to find the egg. When we do that, it keeps that sac that the egg was in. It makes it a little bit less likely to form and develop into the corpus luteum that normally makes progesterone. So when we do IVF, it can keep you from making the right amount of progesterone. So that's the reason we give supplemental progesterone. There are lots of ways to do it. As I mentioned, most programs have gone to using IM progesterone at least until the pregnancy test is positive, and then maybe they're willing to talk to you about changing. That's the way I do. Your provider will tell you what they think is best for you, your situation, and their experience. So Tony, if you'll go ahead and load up that video, we'll watch about drawing up and administering the progesterone, and then I know y'all have some questions after that. Your healthcare provider has recommended that you take progesterone and oil for injection. There are a couple of ways this can be prescribed for you. One is in progesterone and oil that could be sesame oil or peanut oil. The other is progesterone and ethyl oleate. Your provider will tell you exactly which one you need. To administer this medication, you must give it intramuscularly. It's important it go deep into the muscle of your hip to make sure that it doesn't leak out into fatty tissue. You've probably heard some horror stories about people taking progesterone and oil and they say they have redness and irritation and lumps and bumps. But I promise you, if you take it where you put it deep in the muscle, you're not going to have any problems at all and it will be very easy. This is a diagram of where you should give it in the muscle of your hip. It's actually in the upper outer quadrant of your hip, as you can see the green area in this diagram. I tell patients to simply put their hands on their hip bone, relax their palm back, and give it in that muscle. It's called the ventrogluteal muscle, and that's the best place to give it to make sure that it can go deep into the muscle. To give the injection, it's really very easy. It's already mixed up. You start by taking the top off the vial of the medication. The first time you give it, there's no need in wiping it with alcohol, but with your second injection, you want to wipe it with alcohol just before you draw it up. Next, you'll need the syringe that has a needle hooked on it. And you can either use the needle that already comes with a package. It's probably going to be gray to draw it up and to administer it. Or you can change the needle and put on a bigger needle to draw it up. That just makes it easier. It is in oil, so it's going to be a little bit more effort to draw this medicine up than perhaps some of the other medicines you've taken. To put the new needle on, just screw it right on the tip of the syringe. Then remove the needle top, expose the needle. You won't mess it up. The one that looks like a nail is not the one you're going to give it with. And just take the tip of the needle and put it right into the rubber part of the top of the vial. Turn it upside down, making sure you see the needle in the liquid. That way you're not just going to withdraw air. Your prescriber will tell you exactly what your dosage is. The average dosage is about 50 milligrams, so we're going to draw that up today, and that's going to be 1 cc. And you just pull back to the amount that you've been prescribed to take. And I like to pull back right on the line and then withdraw the needle from the vial and then put just a little bit of air in there. When you do that, when you give the injection, it seals it with the air and makes sure you get all of the medication in and none of it's wasted. If you change to put a bigger needle on to withdraw it, just recap it and discard that needle in your sharps container. Put on the smaller one to administer the medication. Only on soap operas is it instant death if you get a little bit of air in there. So if you see a little air bubble in there, It's no problem at all. It's just that little bit of air, just to one line or two to give the air, just to seal it into the muscle. Then choose the location on your hip that you want to give the injection. Take an alcohol pad and wipe the area where you're going to administer it just one time. We know you're already clean. Just wipe it one time, separate the tissue, remove the top from the needle, put the needle straight in all the way. Again, you want to make sure it's going all the way into the muscle, so it's important you put the needle all the way in. Withdraw just a little bit, and you'll probably get a little bit more air. If you get a little bit of blood, just pull the needle back just a tiny bit and go ahead and push the medication in. Again, this medicine is in oil, so it takes a little bit longer to push it in. But once all of it is in, just release the skin, release the plunger, and pull straight out. If you have a little bit of fluid or a little bit of blood come out, there's no cause for alarm. Just take the alcohol pad and apply a little bit of pressure, or just wipe the area off and apply a bandage if necessary. After you give the injection, you can put the needle and syringe directly into a sharps container for safe disposal. And just like that, you've given your injection of progesterone and oil. All right, hopefully that wasn't too scary. With this one for sure, the first one is the scariest. People think about the length of the needle being associated with how uncomfortable the injection is. It's actually the medicine itself if an injection is uncomfortable. It is the medicine itself that can make it uncomfortable, not the length of the needle. This must go directly into the muscle. So that's why we want the needle all the way in. Once in a while, I'll have a patient whose partner may be given their injection and they think they love their partner more than anybody else loves theirs. So they're going to do them a favor and just put the needle in part way and then push the medicine in. Those are the women who call me when they've gotten injections that way, because they do have redness and little lumps or bumps or knots on their hips. Their hips look angry. They feel hot to the touch. And they think progesterone oil is, the spawn of Satan in it, and it's absolutely horrible, and they don't want to do it anymore. On the other hand, when you get the injection, you put the needle straight in all the way, it is going into fat. If you put it in it goes into muscle. If you put it just a little bit in, it's going into fat. And the oil does not get absorbed well when it's given into fat, and it just sits there. And that's why it's going to cause, your body will recognize it as something foreign, and that will cause some lumps, bumps, redness, irritation, warmth. So make sure the needle goes in all the way. Now, once in a while, I'll have patients say, I am so tiny, I can't possibly, that will come out the other side of me if I put that long needle in my hip. It's pretty uncommon to see somebody that's that thin that I worry that an 1.5 inch needle is not going to go into the muscle. More commonly, women that are heavier, an 1.5 inch may just barely get to the muscle. Your nurse or your healthcare provider will tell you what they think is the best size needle, best length needle. But I found that most patients, an 1.5 inch needle is the right length. I like it. When I order this medicine, I always say to send an 18 gauge needle to draw it up. It's thick. And if you have a needle that has a bigger opening in it, then you can draw it up a little more quickly. And when you change the needle to a smaller one that's not quite so big around, then that needle hasn't touched anything before it touches you. So I think it keeps the needle nice and sharp if it's never been used. That's my reason for doing 2 of them. If you just make sure you have a little bit of air in there, you're not going to waste anything. If you don't want to get medicine that's stuck in the needle and throw the needle away. So I recommend that you get a big one to mix it with or to draw it up with, and get one that's a little bit smaller diameter to actually give the injection with. Most people say this injection doesn't hurt. If you can just get past the point of any horror stories you may have heard, you're going to be one of the people that's a cheerleader for others, saying, I put the needle straight in all the way, just like they said on the PharmAssist video, and it really wasn't bad at all. I have more of a problem talking people into stopping taking the medicine after they realize how much easier it is than they ever experienced. People get afraid to stop the medicine because, gosh, I'm pregnant and it's worked so well. If I stop it, maybe I won't be pregnant anymore. Your provider will help you figure out exactly when is an okay time to stop it. That'll be for a discussion a little bit down the road. But this is not a bad injection, so do not be intimidated about doing it. So I'm going to turn it back to Tony. Let's see what kind of questions you have, and we'll chat about it a little bit more.
Yeah, I definitely think you hit the nail on the head. This is probably the medication I get the most anxiety about from patients, even at like their initial consults. They'll come in and be like, do I have to do the progesterone injections? And I'm like, well, we have some time. Let's just get through the first round. But I think the first question we have is, what is the purpose of the progesterone in oil, and why do I have to use a pill instead of doing the suppository?
Okay, so the purpose of this is to stabilize the lining of your uterus. Estrogen, which is the hormone made by the developing follicle, in most part, thickens the lining of your uterus so that a pregnancy can implant. Progesterone, on the other hand, keeps it very stable. So it keeps it from prematurely shedding or being irregular. So estrogen builds, progesterone stabilizes. And since during IVF and occasional other patients, the corpus luteum of the body may not make progesterone well enough, then that's why the progesterone is recommended that be taken. Why take injectable progesterone over maybe a pill or a suppository or a gel and soon to be a vaginal ring? Why not do something that doesn't seem so evil as an 1.5-inch long needle? Well, your provider is going to tell you what they think is best for you, but there was a prize-winning paper that was presented at our national medical organization. It's an international organization that's right here in the United States, looking at different types of progesterone. Huge number of patients in this, and they showed that people that started out with progesterone and oil had a higher pregnancy rate. Now, this was one center, one of the biggest centers in the country, but it was just one center, huge numbers of patients. I kind of ascribe to that thought too. Just I have a smaller practice, but I am a believer in that too. However, in other people's hands, it may be that you can use a vaginal suppository or a vaginal gel, or perhaps a drug that's normally given by mouth to be used vaginally. Your provider may say that that's okay. But many, I would say most programs in this country and in the world recommend that you take progesterone and oil. There are 2 oil formulations that I mentioned. One of them is usually in sesame oil. Mandel's has the ability to compound this medicine, and it can be given either where they make it in the lab, and it can be given in alternative oils if you're allergic to sesame, such as olive oil. They can also compound it in an oil called ethyl oleate, which is not nearly as thick. So ask your provider what they think and what works well in their hands, and they will help guide you as to what is best for you and what will be easiest for you. At the end of the day, you don't want to worry if you, God forbid, don't get pregnant. Is it because I didn't do what my provider told me to, what they think is best for me? So trust your provider, but know that you have lots of resources. You have your nurse, you have the providers, you have the other members of the team at your provider's office, and you also have the staff at Mandel's who can always walk you through this and make sure that you have no question that is unanswered.
Yeah, I agree. The next question we have, and we don't see this too often, but I have seen this, since I've been practicing. Is there any side effects with the progesterone and oil? And then what can I do if I were to say break out in a rash or something like that?
Great question. Well, if you should have a rash, for example, my first thought is that whoever gave you the injection didn't put the needle in all the way. So if you call me and you say, oh, I've got a rash, I think it's from the progesterone. It feels kind of warm and a little bit lumpy. What do I do? I'm going to ask you about how the injection was given, or I may want to speak to the person that gave it to you. The other thing I'm going to wonder, can you eat food at a Chinese restaurant? How do you do with sesame oil? Because most likely that's going to be the type of oil that your progesterone is in. And then lo and behold, you say, God, last time I had Chinese food, I had this itching and it bothered me. Maybe you're allergic to the oil. If that were the case, we could change the type of oil that it's in. Most commonly, it's going to be because the needle wasn't put straight in all the way. Now, what can you do to keep this from happening? I have a couple of little tricks that I like to share with patients. One, when you get this injection, I recommend that you stand up and kind of lean over a counter. So the kitchen counter or the bathroom counter or sink or whatever. And whichever side you're getting that injection on, raise that leg up a little bit. And that takes the muscle fibers and just kind of relaxes them a little bit when you take your weight off of that leg. And it makes the needle go in a little bit easier. Another thing I like to tell people that if you're really terrified of it, there are some patches that you can talk to your provider about getting. They're called Sanera. They cost about $10 a piece. So if your insurance covers it, great. If your insurance doesn't cover it, you might want to think, maybe I'm not so afraid after all. But it looks like a big Band-Aid that's about this big. And you just peel the back of it off like you would a Band-Aid and apply it to the area about 20 or 30 minutes before you give the injection. And that warms and numbs the area where you're going to give the injection. You can only use it one time. You can't cut it in half. That kind of messes up the way it works. You have to use one for the injection. I have some patients who like to use those even when they have blood drawn because they hate needles just that bad. And they have a favorite vein they like to have stuck, and they'll put the patch on their arm right here, and we'll know when they come in, oh yeah, that's the lady that hates to have her blood drawn, and she'll have that patch that'll kind of warm it and numb it so she's not going to feel her blood being drawn. So that's one thing that you can do. If it does get red or irritated or angry looking, always give us a call. Let us know. Let us help try to figure out what it is. It's fine to put a warm compress on it. It's a little bit of a debate. It's kind of funny. I've listened to a number of providers do these videos, and some people say, oh, you should ice it first. And other people say, no, you should heat it first. Well, in my mind, I think it's better to have it a little bit warm. Then you don't want it hot, but maybe to warm it up a little bit. And again, if you'll take the vial just before you give it and do like this with it in your hands and just warm it up, have it come to body temperature a little bit before you give it, it's going to thin it out just a little bit. And if you want to put something on your hip, if you don't have the Sanera patches, you might want to put a heating pad on your hip just for a couple of minutes. So it'll be, your hip will be nice and warm. Put the medicine in, and I think you're going to do great with it. You're going to probably go back and laugh at me after you do your first injection. Say, gosh, I worried about this, and she told me to make sure it goes in all the way. And my partner didn't have any problem at all putting that needle in all the way. He said, bring me a longer one or whatever. So you're probably going to look back at this and laugh a little bit and say it was such a nothing thing. But do make sure, the one thing I want to tell you is to make sure the needle goes all the way in. If you're a tiny little thing and we think 1.5 inches is too long, whoever's ordering your medicine for you will take that into account. And if you are particularly worried about it, just talk to your doctor or your nurse, and we'll make sure that you feel comfortable with it, and we're doing what we think is right for you.
Absolutely. This is a really good question and very important. So what happens if I were to miss my progesterone and oil injection?
Great question. You know, we always want you to take your medicine just like we tell you to, and we're probably going to give you a little calendar that says do this on this day and do it this way. But we all are human, and we forget things. And um, I hope that this doesn't totally consume your life, even when it certainly feels to you like it is. So if you forget an injection, if you're a few hours late, just go ahead and take it. It doesn't have to be given exactly 24 hours apart. I tell people to take it in that time frame. So if you take your injections when you get home from work, one day you get home at 5, you take it then. The next day you forgot you have a meeting after work and you don't take it till 8. That's perfectly fine. What we don't want you to do is to take one at, I think you're going to take them right before bed. You take one at 11:30 at night, and you think, oh, well, tomorrow I'll take it as soon as I get up in the morning. So I want you to space it out a bit, around 24 hours, but take it about the same time each day. If you forget it, we're probably not going to tell you to double the dose or to take two that are really close together. But if you forget it, just give your healthcare provider a call, just for reassurance on what to do. This medicine is pretty forgiving, and I don't recommend people skip doses, but if you miss one, I don't think it's going to be the end of the world, and I don't think it's going to make or break whether or not you get pregnant. I have had a few people, like maybe 3 in my career, who just decided they weren't going to do progesterone at all, who have gotten pregnant. Um, Again, it's not what I recommend, but um, this is what we think is best for you to do, but it is still pretty forgiving.
Absolutely. I don't really see any other questions coming in right now. So I guess we could give everybody a few more seconds in case there's any just general questions. Anything else we maybe want to add on the progesterone before we wrap up for the evening?
Perfect. Yeah, I just kind of want to go back one more time with the progesterone. I do recommend that you take it in your hip. Some people want to give it in their outer thigh, but I think it's a little bit more likely to bruise there. I think your hip is probably the best place. And I probably have 5 or 10% of my patients who give their own injections, even their progesterone. So even if you're going to give it to yourself, that you can still do it in the muscle of your hip. Um, I like to draw targets on my patients. I draw little parentheses, right, and anywhere in the parentheses you can give the injection. Uh, Most of us carry a Sharpie in our purse just so we can do just that, to make sure you know exactly where to give these injections. Sometimes patients want to come in for the very first one and let us watch how you do it, or you watch us to see how we do it. Either way with that is perfectly fine. But don't be intimidated by any of these medications. We are here for you, your providers and your doctors, your nurses. We all want you to be pregnant. The only people that want it as much as you and your family is us. We really want this for you, and we will do everything in our power that is possible to help you achieve your goals and your dreams. But do utilize your resources. If you have questions, you're worried about something, call us. I would always rather somebody err on the side of calling too much than not calling enough. So call if you have questions, send a message through the portal. However you like to communicate with your healthcare team, do that. And also remember, the folks at Mandel's are happy to answer your questions too. These videos are meant to be general information to help you along the way. I'm not the only one that does it. There are several of us from around the country that do these videos. They're all available at my Mandel's pharmacy.com and on the Facebook page for Mandel Specialty Pharmacy. So you can take a look at either of those places. You can get second opinions even from the team of us that are doing these videos if you want. And they're all provided as a service from Mandel's. So take advantage of these opportunities, and always err on the side of contacting us too much instead of not enough.
Yeah, I definitely agree. We, at our office, our patients like us to draw the circles on them as well. Oops, Sorry, I don't have my video turned off. They like us to draw on them with the Sharpies, and then they'll come back in to get their next oil or at their lab appointment. And they're like, can you just trace the circle again for my husband or for my partner? So we're always definitely very happy to answer questions. There's no silly question. We'd rather you ask the question than mess up your medications. So we always try to keep kind of open lines of communication in our office, and you know, we welcome all questions from everyone. So
Perfect.
I don't think we have any more questions for tonight. So I think we can kind of wrap it up and close. Just want to thank you, Karen, for all your expertise tonight. Able to answer questions and answer them in a comfortable space is what we like to do here. I want to thank everyone that joined us on Facebook and on Zoom. We hope you were able to learn something, even if you didn't ask a question tonight. We hope we answered something that you might have been thinking. And don't forget all these virtual learning videos, like Karen said, and the product demonstrations are available on the YouTube page, the Facebook page, and the mymandelsPharmacy.com /PharmAssist. We believe that the repetition leads to retention. So the more you hear it, the more you see it, the more comfortable you're going to be. We look forward to seeing everyone again next Monday night. We'll have another great program. We'll feature different medications. So if you know anyone that would be interested, or you think the PharmAssist program would benefit them, a family member, a colleague, or a friend, anyone going through fertility treatment that you know, shoot them our way. We'll be happy to answer any questions for them and teach them some things. So thank you, Karen, and thank you everyone for joining us. We'll see you guys next week. Thank you.